Cats are the most popular pet in America, and it's easy to see why. They're smart, loving, athletic, and just plain fun to be with. Although most cat owners consider their cats to be family members, millions of cats in the U.S. do not receive much-needed veterinary care. In fact, statistics show that they visit the veterinarian only half as often as dogs. Some reasons are that it can be difficult to get a cat to the veterinarian, and cat lovers don't want to upset or stress their cat with veterinary visits. Unfortunately, cats and cat lovers, and even veterinarians, suffer because of this lack of care. We as veterinarians can help our clients by educating them about reducing the stress of bringing their cat to the veterinary hospital and by handling cats respectfully. Helping cats be more comfortable and calm is a win-win-win situation for cats, clients, and veterinary teams. As veterinarians, we can have increased safety and job satisfaction, in addition to increasing the number of cat patients and visits. To help clients make the veterinary visit as pleasant as possible, teach clients how to make the carrier a haven by keeping the carrier out in a room that the cat likes to be in. A comfortable blanket or familiar clothing from a favorite person placed in the carrier, plus treats or toys, will entice the cat to enter on its own. If the cat won't go in on its own, entice it by throwing kibbles or treats into the carrier. Reward entry with more treats and calm praise. Once a cat is regularly going into the carrier and uses it for resting, encourage owners to take their cats on periodic car rides paired with positive experiences. Bringing toys, blankets, treats, and even a comb if the cat enjoys grooming help make the trip more familiar. The travel should be on an empty stomach to prevent motion sickness and to increase interest in treats at the veterinary hospital, creating a more positive experience. A synthetic feline pheromone sprayed in the carrier 30 minutes before travel often has a calming effect on the cat. Most cats are fearful when taken out of their normal environment, and the sounds, smells, and sight of strange people and animals exacerbate the fear. We want to prevent that fear for humane reasons, and also because fear is the most common cause of cat aggression in the veterinary hospital. Whenever possible, it is best to keep the cat in the exam room for the entire visit. Try to schedule your appointments so the cat and client can be brought directly to the exam room instead of waiting in the reception area. With most cats, the entire exam and all lab sample collections can be done right in the exam room. In fact, many clients prefer to watch, and they appreciate that their cat doesn't have to be taken to the back. If they don't want to watch, they can wait in the reception area. Obtain the history from the client with the carrier door open so that the cat can explore the environment if desired. If the cat is anxious or fearful, ignore the cat and do not make direct eye contact. Eye contact by a stranger is considered a threat to the cat. The best place to examine the cat is where the cat wants to be, whether it's the floor, a bench, a scale, an exam table, or even a lap. If preferred and the cat allows it, a cat can be examined on your lap. Gently pick up and put the cat in your lap with a towel or blanket from home underneath it. It is best for the cat to face the client with the hind end against your body and kept in place with the cat against one of your arms. This allows comfortable handling with minimal restraint. If the cat refuses to come out of the carrier, remove the top of the carrier whenever possible and allow the cat to remain in the bottom half of the carrier for much or all of the exam. If the cat is anxious, slip a towel between the top and bottom halves of the carrier so that the cat will be covered with the towel when the top half of the carrier is removed. This provides a safe hiding place for the cat and allows you to wrap the towel around the cat when needed. Always try to allow the cat to remain in the most natural and comfortable positions to prevent additional fear and discomfort. A highly fearful or anxious cat should receive anti-anxiety medication such as alprazolam at home. This is in favor of traditional tranquilizers like acepromazine, which do nothing to decrease the anxiety. Always use analgesia if the cat is painful or painful procedures need to be performed. Senior patients commonly have arthritis and can be especially painful. Occasionally, sedation or anesthesia is needed for highly anxious or painful cats. This message has been brought to you by the Catalyst Council, where all cats are valued and cared for.